Hello, everyone. Bonjour à toutes et tous. I'm Kathleen Flynn-Dapa. I'm the Director for Education, Gender-Based Violence, and Child Protection here at Global Affairs Canada. And I want to wish everyone a belated but happy International Day of the Girl. Bonne fête internationale des filles. We're really happy to be able to mark this important day in such good company amongst our partners and colleagues, and I look forward to hearing the thoughts and insights today. Although we're on an online platform and they can be a bit intimidating and not as enjoyable as a meeting in person, I really appreciate that technology is allowing us to meet virtually during this challenging times. The COVID pandemic has had devastating impacts on so many, and I appreciate that we still can find ways to collaborate on important human rights issues, such as the right to education and preventing and addressing gender-based violence. I want to acknowledge the Indigenous people of all the lands that we're on today and take a moment to recognize the importance of the land that we each call home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we can reach each in our own way, try to move forward in a spirit of reconciliation and collaboration. We recognize that Ottawa, where I am speaking to you from, is located on unceded territory of the Algonquin Anishinaabe Nation, and we extend our respect to all First Nations, Inuit, and Métis peoples for their valuable past and present contributions to this land. Before we begin the program, I want to share a few housekeeping rules with you. All participants have been muted. Please note the event is being recorded. Following the panel, we will have a question and answer period, and you can use the Q&A function to ask questions in English or French throughout the event. This Q&A button is located at the bottom of a screen on your computers and sometimes on mobile devices at the top of the screen. And as people are posing questions, if one resonates with you, please go ahead and use the thumbs up button so we know which questions are of particular interest to people. If you have a question for a particular panelist, please specify their name or the name of the organization in your question. Should you have any technical issues, please contact Andre or Zora. You can look in the chat, they'll be posting their email addresses for that. Et pour commencer le programme, j'ai le plaisir de vous présenter notre hôte et modérateur, Peter McDougall, le sous-ministre adjoint pour les enjeux mondiaux et le développement ici à Affaires mondiales Canada. Over to you, Peter.
Thanks very much, Kathleen. Bonjour tout le monde. Ça me fait grand plaisir de me joindre à vous aujourd'hui au nom du gouvernement du Canada pour fêter, pour célébrer cette journée internationale des filles 2020. Cette journée est clairement extrêmement importante. C'est l'occasion pour le monde de reconnaître la voix de toutes les filles, de mettre en lumière les défis auxquels elles sont confrontées tous les jours et de promouvoir leur autonomisation et la réalisation de leurs droits fondamentaux. The theme of our event today is gender-based violence as a barrier to girls' education. I'm pleased to take part in today's discussion to share how Canada, along with our dedicated partners, has been working to fight gender-based violence to improve the lives of girls and women and to deliver on our commitments from the Whistler Declaration on unlocking the potential of adolescent girls and the G7 Charlevoix Declaration on quality education for girls, adolescent girls, and women in developing countries. Through the Charlevoix Declaration, Canada galvanized an historic G7 investment of $3.8 billion, including $400 million from Canada to support quality education and learning for girls, adolescent girls, and women. We took an approach that not only addressed the quality of education in schools, but also the barriers that prevent girls from accessing school and completing their education. Building on a strong portfolio that brought education and child protection together, the Charlevoix Declaration and Canada's programming tackle gender-based violence as a key barrier to girls' education. We know that gender-based violence is deeply rooted in gender inequality and in social norms that disempower and discriminate. It can take many forms, such as physical, psychological, and sexual violence, child early and forced marriage, and female genital mutilation or cutting. It jeopardizes girls' health, denies them of their right to education, and limits their ability to fully contribute to the development of their families, communities, and countries. This year, the outbreak of COVID-19 has heightened the risk for girls due to confinement, school closures, the additional economic pressures facing families, and the disruption of aid programs. While countries and health systems are struggling to respond to this crisis, it's more important than ever to recognize underlying inequalities and discrimination that put girls at heightened risk of harm. At the peak of the pandemic, over 1 billion learners were out of school because of closures, and many have yet to reopen. The longer schools are closed, the greater the risk that girls will not return when schools start up again. Canada has joined the voices of many in recognizing that it is critical that we continue to meet specific needs and priorities of girls and adolescents during this period. We have been having discussions in recent weeks and months, both here in the department and with all of you in different fora, about how we do this and how we take the opportunity of COVID to do even better than we were doing before the pandemic hit. How do we ensure that girls continue to learn during school closures and that reopening plans target girls to ensure they return to school? How do we address barriers that girls and adolescent girls face and threaten to keep them out of school permanently? What does it look like to prioritize our support for the prevention of and response to gender-based violence and harmful practices? How do we ensure that sexual and reproductive health services are recognized as essential parts of the pandemic response, as something that cannot be reallocated? And perhaps most importantly, how to engage young people to both understand the challenge they face and to find solutions. And we need to work in partnership, an effort that brings together the power of grassroots, supports national governments, and unites global and multilateral partners in a common effort to ensure that girls are not left behind. We have real work to do, but as we will learn from our trusted partners today, we have a strong foundation to build on and should continue to build the evidence of what works to generate action and positive change. I look forward to today's discussion. Let me turn it over now to Daniela Ligero.
Hello there.
From Together. Here you go.
Oh.
Go ahead.
Yeah, all right. Hi, everyone. Great to be here. I'm Daniela Ligero with Together for Girls. Bonjour à tous et toutes. C'est un plaisir d'être avec vous ici aujourd'hui. I'm going to share my screen and you're going to let me know if that is working. Hold on. It says it's been disabled, so someone needs to, it says host has disabled participant screen sharing. So I'll wait for the host to try that. Aha. Can you see it now? Yeah. All right, I'm gonna get started. I'm gonna split up my presentation into 3 parts. I'm gonna do a brief background on our organization. I'm gonna jump into what the data tell us. And then I'm gonna finalize by talking about some evidence-based solutions and next steps. So let me start with some background. As was mentioned earlier, we are an organization focused on ending violence against children with special attention to sexual violence and to adolescent girls because they are the most affected. And we were founded 10 years ago from an understanding that when you're talking about an issue of this magnitude, there isn't a single actor or sector alone that can really make a difference. We have to work in partnership. And so Together for Girls is a partnership that brings together various UN agencies, governments, private sector organizations, civil society. We're delighted that the government of Canada joined Together for Girls several years ago. And our model is pretty straightforward. It's been the same for the last 10 years. And in fact, I want to acknowledge Gary Cohen, who is the founder of Together for Girls from BD, who's also on the line. The model has survived the test of time. Data, action, and advocacy. So data is really about getting evidence and strong data to inform understanding the magnitude of the problem as well as solutions that work. And we do this first and foremost through the VACS, the Violence Against Children and Youth Surveys. They're led by CDC, the US Centers for Disease Control, with support from various partners and national governments. And they're population-based surveys that really give you a big snapshot of what's happening on these issues at a country level. We also do targeted and strategic advocacy and communications to raise awareness, improve the use of data, elevate the voices of survivors, all of that so that we can have action on the ground, programs that are multi-sectoral, evidence-based, and creating meaningful change in the lives of girls. We are currently working in 23 countries. This gives you a sense of the places where we've already completed these VACS surveys, the places that are still forthcoming, and some plans to actually repeat some of the surveys like Kenya that just repeated. And what's exciting is that over the last 10 years, we have been able to gather data for over 10% of the world's population under the age of 24 for these issues, making it the single largest repository of data on violence against children, adolescents, and youth worldwide. Topics covered in the VACS surveys include physical, sexual, emotional violence, but also a lot on risk factors, protective factors, demographics, health issues, including sexual reproductive health and HIV, child marriage, education, gender attitudes, so much more. So now let me tell you a little bit about, in the second part, what the data are telling us. And so through the last 10 years of surveys, we have been able to see, and again, I'm going to share with you just some snippets of data. There's so much to share, I couldn't possibly do it in 15 minutes. But we found overall that children experience very high levels of sexual violence. This is especially true for girls, but also higher than expected for boys. So for example, in Rwanda, we can see that 24% of girls experience some kind of sexual violence before the age of 18. And the same is true for 10% of boys. And again, these are population level data that speak to the country. So if you look at all these countries, we're really talking about millions of children that experience sexual violence every year. We've also looked quite a bit at what are the relationships between, for example, health outcomes and sexual violence. And this graph shows specific relationships for sexual violence in girls, especially adolescent girls, are the most affected in Eswatini, what used to be known as Swaziland. And here, these are odd ratios. So what that means is that if a girl experiences sexual violence in Swaziland, she's 3.7 times more likely to have HIV or an STD, 3 times as likely to have an unintended pregnancy, twice as likely to attempt suicide. And so you just get a sense of the variety of health outcomes that are impacted by sexual violence. Now, what's been interesting is that in the last year, working with the support of the government of Canada and also with support from USAID and the US government, we've been able to go into these massive amounts of data to understand what's happening when it comes to education. And I have some initial results to share with you. There's a lot more that's coming. But the two kind of top line messages from our additional analyses looking at education and the relationship to gender-based violence are really twofold. The first is that education is central to gender equality and to ending gender-based violence. And the second realization is that schools are often not safe and that this affects educational outcomes. And we need to be able to hold those two truths at the same time if we're going to be effective. So on the first one, I'm not going to say too much because it's not just our research. There are decades of research that show that education is one of the best investments you can make, especially when you're talking about girls' education, and at this point, secondary education, where girls continue to lag behind. So there's so much data to support this. This is absolutely critical, and I'm not going to get into it because I know you all know these data. The second piece that we have to hold at the same time is that schools are often not safe, and this has an impact for educational outcomes. So, for example, we found just in these recent analyses that girls and boys experience high levels of physical and sexual violence in schools. So what this graph shows is, for example, that in Nigeria, 44% of female students and 35% of male students say they've experienced some form of sexual or physical violence in a school setting. And again, this is population level, so it translates into millions of students every year experiencing violence. And you get a sense from some of the other countries that we've looked at so far. Another finding has been that the majority of the violence perpetrated in schools is actually perpetrated by male students. And so what this graph shows is on the left-hand side, you have the percentage of students who experience, in this case, physical violence perpetrated by a male student. And you can see both boys and girls experience quite high levels of physical violence by male students. On the right-hand side, you have the percentage of physical violence perpetrated by female students. So the majority of the violence is perpetrated by male students. And this is also true for sexual violence. This affects attendance. So again, connecting to educational outcomes. We found in these countries, for example, in Uganda, 29% of girls and 27% of boys say that they've missed school as a result of physical violence by a classmate. Again, huge implications for our programming moving forward. On sexual violence, we find that both students and teachers perpetrate sexual violence against girls. Although students still perpetrate the majority of the sexual violence. And so in Nigeria, 6% of the sexual violence is perpetrated by a classmate and 2% by a teacher. Again, extremely high because you're talking population level. Finally, corporal punishment is gendered and really widespread. We have found that, for example, on the left-hand side, you can see male teachers and their perpetration of physical violence, or what's known as corporal punishment, seen sometimes to discipline students, is mostly perpetrated by male teachers against both female and male students, although female teachers also perpetrate, albeit at much lower numbers. And we found that both corporal punishment and sexual violence also have a series of relationships with attendance, learning, and other outcomes, which I don't have time to get into here today, but it really gives you a sense. I want to transition now into talking a little bit about humanitarian settings. And I know that Canada has been so committed to making sure that education and violence are addressed in these settings. And we're delighted that the Government of Canada has been supporting us in a partnership with the US Centers for Disease Control, CDC, and IRC to take the survey that exists, the VAX, the methodology, the questionnaire that gives us all the kinds of data we've had and that I was able to present, but to actually modify that so that we can do that in a variety of fragile settings, including humanitarian settings. And we are currently almost done with this. Next month, we'll be able to showcase the new questionnaire and the new methodology. We've gotten input from experts from all over the world over the last year to do this. And the vision is that we have also added a lot of questions around education, and we hope that we can actually implement the survey starting next year in a variety of contexts. Let me go now to my third part, which is solutions and next steps. I'm keeping track of time here, Kathleen, so I should be good. I would be remiss not to mention COVID-19. Of course, the pandemic, as Peter mentioned, really threatens so many of our achievements in terms of not only the progress we've made, but actually, going back on the progress. And this has to do with kids out of school and all the girls that are now estimated will not go back to school after the crisis. Poverty and some of the estimations of over 42 to 66 million falling into poverty. And of course, the issues I mentioned already around humanitarian settings and the challenges we had before and now moving forward will be exacerbated. So it's important to think about these challenges. But I also think there's some opportunities, and Peter, you mentioned this, to kind of think more strategically and build back better. And for me, one of the strategies and the opportunities really is, from all the evidence and the data and the work we've done, how do we think comprehensively about a vision for girls that includes having them be healthy, educated, and safe? And the more we understand the data and the issue, the problems, the solutions, the more we understand that these things are interconnected and you can't just do one without the other. So when you're thinking about health, sexual reproductive health is so critical to girls. How do you create synergies between these three and the vision for girls. And for us, it really is about investing in evidence-based solutions. Again, we're an organization that puts data and evidence at the forefront of everything we do. Last year, we were able to do a global review with our partners of what works to prevent sexual violence against children, especially adolescent girls. And there's so many interventions that actually have data and evidence behind them that work. And so moving forward, I think there are kind of four buckets of kinds of interventions that we need to be thinking about as we protect the progress, but also build back better. And I was really delighted that yesterday when the Global Education Monitoring Report was launched, some of these were highlighted. So the first is really supporting enrollment, learning, and completion, and all the kinds of interventions that the education sector knows work, especially when it comes to girls. The second is this issue of barriers to girls' education, especially unintended pregnancy, child marriage, which I know we'll hear more about, and sexual and gender-based violence are critical to addressing so that girls can be educated. The third is supporting changing norms in education. And this includes kind of gender norms in the education sector, but also how do we change corporal punishment, pre-service, in-service training for teachers. There are a lot of interventions we know have evidence behind them that can be effective. And then finally, creating safe learning environments. And again, when the report was launched yesterday, I was really delighted to see that as one of the key recommendations. There is evidence that shows that we can create safe learning environments, especially for adolescent girls. Some of those interventions include Doorways 3, Good Schools Toolkits, interventions that have been rigorously evaluated and have shown to have impact. And we have to think about all of that. And so for us, just to wrap up, moving forward, we hope to continue to work with you to disseminate the data we have and will have moving forward to support global, national, and community level advocacy. We hope to be able to implement the VAX module in humanitarian settings starting next year. Additional research on barriers to girls' education that we're doing with our partners moving forward, as well as really thinking through, and I was delighted, Peter, to hear you talk about not only mitigating COVID impact, but really, how do we think about building back better? And so on that note, I want to close with a quote from my fellow Brazilian, Paulo Coelho. We've been thinking so much about that these last several months. And that is, he said, you know, the only thing tragedy gives us is the opportunity to rebuild our lives. And so I think in the midst of this tragedy that is the COVID-19 pandemic, how can we re-envision a future that is brighter, safer for girls, especially when we think about connecting education, health, and safety in new and strategic ways. And we're looking forward to working with all of you on that. Thanks so much. Peter, I'm going to stop sharing and I'm going to hand it over to you. Thanks so much. Merci beaucoup.
Merci à toi. Thank you very much, Daniela, and thank you so much for your presentation. It really underscores the challenges that girls face, not only in getting to school, but staying in school, particularly as they grow older. And I also just want to take a moment to thank you and your organization for your very strong reliance on data and evidence to inform programming. It's really critical, you know, whether we're, as you say, building back better or even, you know, pre-COVID, it's essential that we continue to rely on data and evidence to advance our work. Keen to continue to follow your work on the children surveys in humanitarian settings. So look forward to seeing that work once it comes. I bobbled Daniela's introduction, so I'll try not to do it on the next one. And thanks for filling in the gaps, Daniela, on Together for Girls. Our next panelists are Lindsay Gladding from World Vision Canada and Annie Bodmer-Roy from UNICEF Canada, representing the International Child Protection Network of Canada and the Canadian International Education Policy Working Groups. These two networks have been very important strategic partners of ours at Global Affairs Canada. Our engagements with the networks and with these organizations and their members have helped to establish Canada as a global leader on child protection, CEFM, girls' education, particularly in conflict and crisis situations. Over the last 7 months, we've begun engaging with them to understand how COVID is affecting girls on the ground and to seek their insights into how Canada can continue to show leadership on these issues as we respond and recover from the pandemic. Thanks very much to both of you. Over to you, Lindsay and Annie.
Thanks very much, Peter. I'm just going to get my screen sharing started, and then we will get through the presentation. So just before I do start, confirming that you can see the slideshow and not my presenter view. Good. All right. So again, thanks very much for inviting us to be part of this conversation today. The International Child Protection Network of Canada is a coalition of 14 organizations plus individual members who are really focused on strengthening child protection programming and policies in international development and the work that we do as Canadian organizations. The Canadian International Education Policy Working Group, CIPWIG, is a coalition of 20 international development humanitarian advocacy organizations that are working to support policies and programs to improve access to safe, inclusive, quality education for all children and youth. Together, ICPNC and CIPWIG represent the majority of Canada's child-focused and other large INGOs. So today we've been asked to share the learnings of Canadian partners on this important topic and our recommendations for how we can move forward together. So over the course of the next few minutes, I'm going to discuss what our members as international organizations and implementing partners with close connections to local communities are seeing and doing to address gender-based violence and ensure that girls can access the education that they're entitled to. And then I'll pass it over to my colleague Annie to discuss some concrete recommendations and next steps that Canada can take. But let me just start with an important point. As the Convention on the Rights of the Child sets out, both education and protection from violence are fundamental rights of all girls and boys. Like all human rights, they are indivisible and interdependent. We can't have one without the other, which requires us to have intersectional and holistic approaches being central to all that we do. Sorry, this is tricky managing multiple slides here. Here we go. So it goes without saying that the COVID-19 pandemic is having a profound impact everywhere, but that the secondary impacts are particularly profound in the least developed and conflict-affected contexts. So that means both in the immediate direct impacts that we're seeing around the world, but also those that we know are going to continue indirectly for years to come, particularly if we don't start taking action now. So the West Africa Ebola outbreak response provided many valuable lessons for us as we look at how to respond to the impacts of COVID-19 and particularly how that has impacting girls' access to education. So across Guinea, Liberia, and Sierra Leone, the outbreak and related school closures were accompanied by spikes in abuse, sexual exploitation, forced marriage, adolescent pregnancy, child labor, various forms of violence against children and especially girls. And what's more, we saw that the systems designed to keep girls and boys safe, whether those are formal child protection systems, community-based mechanisms, or schools, were weakened, and child protection responses were either delayed, underfunded, or insufficiently integrated by the international humanitarian community. So many children, especially girls, did not return to school when the Ebola outbreak ended. And we know that school can be an essential lifeline and protective environment for girls and boys. Teachers are very often the first point of contact for children experiencing violence, and they can report and make referrals to child protection systems. So with schools closed, girls are doubly disadvantaged. They're both at heightened risk for experiencing violence, and they have a decreased ability to seek help from supportive friends and teachers. So let's talk some numbers. 1.1 billion children have been out of school worldwide due to school closures linked to the coronavirus pandemic. That includes 702 million students from pre-primary through secondary in developing countries. So informed by the evidence from the Ebola response and based on some preliminary observations on the ground early on in the COVID pandemic response, World Vision estimated that up to 85 million more girls and boys worldwide could be exposed to violence, including gender-based violence, as a result of COVID and resultant lockdown measures. In April of this year, UNFPA predicted that 13 million additional child marriages could occur in the next 10 years as a negative coping mechanism to respond to economic pressures and the loss of family livelihoods. More recently, Save the Children has made a more conservative estimate of 2.5 million girls being married in the next 5 years. It's important to keep in mind that either way, these estimates are in addition to the 12 million child marriages that already occur each year. Of course, we know when girls are married, they will almost certainly not be going back to school, missing out on the promise of an education. According to the Malala Fund, 20 million additional girls are likely to drop out of school due to COVID, including 50% of girls enrolled in secondary schools in humanitarian settings. So we know that school closures during crises can lead to increases in teenage pregnancy by as much as 65%. And World Vision has estimated that as a result, 1 million girls in sub-Saharan Africa alone may be blocked from returning to school, even as they reopen after closures due to COVID-19. So the odds are very much stacked against women and girls as we look at the impacts of COVID-19 and the situations that women and girls face. So going beyond modeling, we're also beginning to be far enough along in this pandemic to be able to observe actual impacts. So last month, Save the Children released the results of a survey of children and their caregivers across 37 countries. And it found that over 1.5 billion children have been affected by school closures, with 80% of children saying that they learned little or nothing at all during the pandemic. I'm a parent myself, and I can certainly say that rings true in my household. It may be common for you as well. Violence in the household was reported by children at over double the rate when schools were closed compared for when schools were open and the child was attending in person. Almost 1 in 5 children reported violence occurring at homes with an income loss due to COVID-19 compared to 1 in 20 with no income loss. So the numbers and statistics I've shared with you are overwhelming. The impacts faced by girls and women, particularly during this time of the COVID pandemic, seem insurmountable. So how are Canadian partners responding? First, we're adapting service delivery to virtual wherever it's possible and appropriate to do so, and intentionally strengthening linkages between child protection and education systems. So that looks like in Lebanon, World Vision is providing mobile recharge cards to caregivers to ensure that teachers can stay in touch and provide lessons through WhatsApp, in addition to psychosocial support and sensitization issues on such issues such as GBV. We're adapting online platforms to make sure that girls with disabilities can access educational content. So that looks like something as simple as providing sign language video for girls with hearing impairments, such as what UNICEF and its partners are doing in Somalia. With the increased reliance on virtual services, however, it's really vitally important that we close the digital gender divide that we know exists, particularly given the importance of remote learning in the context we're living in now. We're continuing to face-to-face services where possible. So in Bangladesh, Save the Children is supporting sessions delivered by education facilitators in outdoor spaces, wearing personal protective equipment, making sure that girls are not losing out on an opportunity to go to school. We're supporting girls and families to lessen the economic shocks of COVID that we know can contribute to violence and keep girls from returning to school. So in Kenya, the World University Services of Canada has delivered additional cash transfers to families, which act as social protection mechanisms to reduce girls' vulnerability to forced marriage and transactional sex. And we're adapting community engagement and communication. So in Colombia, Plan International is using WhatsApp and Facebook to share information about critical services. And as part of the Tanzania Ending Child Marriage Initiative, Right to Play has developed a radio drama series that's broadcast by Radio Free Africa and includes messages on gender equality, informational referral pathways for sexual and gender-based violence. And finally, a key approach in our work has been advocating to enable social service providers to continue their work and ensure continuity of services. So that means that it's essential that child protection and gender-based violence service providers are recognized as life-saving, officially designated as essential for the COVID-19 response, and that the men and women providing these services are equipped with the necessary protective equipment to ensure that they can continue to operate safely. I'll now hand over to my colleague Annie, who will spend some time discussing some concrete recommendations in more detail. Over to you, Annie.
Thank you, Lindsay. I'll just start with this slide here because really it brings to light the first kind of recommendation that our two groups, the ICP&C and CIPWIG, wanted to highlight, which is really the integrated nature of education and protection. So recognizing how different forms of gender-based violence act as a barrier to girls' education. So looking at female genital mutilation, cutting, child marriage, to rape and other forms of sexual violence, we all know that gender-based violence has an undeniable and often irreversible impact on girls' ability to access quality education. And likewise, that education can act as a powerful protective mechanism against gender-based violence. Notwithstanding some of the information provided earlier in the presentation by Together for Girls, we also know that education can actually protect girls against different forms of violence, looking at the range of response, mitigation, and prevention efforts from case management, mental health and psychosocial support, providing interventions around menstrual hygiene management and opportunities for girls' safe and meaningful participation in policy and in social norms change. Education and specifically access to schools can provide a lot of these. So we know that education and protection have a direct impact on each other and on girls' immediate and long-term well-being. So the response must also go hand in hand. To ensure an integrated approach to girls' education and protection, Canada should champion and increase its own support for cross-sectoral approaches to prevent and respond to gender-based violence and strengthen child protection and education systems. So this could include, for example, continued dialogue with Canadian partners and global partners, so continuing on what we're doing here today to really look at evidence-based approaches to integrated education and protection programming, including in fragile and humanitarian contexts. And that dialogue could inform Canada's ongoing programming in GBV and in education, including in the context of COVID-19. It could also include strong and consistent encouragement of Canadian and international partners to contribute to and follow emerging guidance and evidence in relation to integrated programming on education and GBV, such as, for example, the Child Protection Education Emergencies Collaboration Framework that was produced by the Global Education Cluster and Child Protection Area of Responsibility. And then also championing integrated holistic approaches to adolescent girls' empowerment, including through education and GBV in particular. So using Canada's leadership roles in different international fora, for example, Canada's leadership on the GBV Call to Action and Canada's role as co-lead of the Action Coalition on Feminist Movements and Leadership. The second recommendation is increasing prioritization of gender-based violence alongside education as core pillars of Canada's international response to COVID-19. So prior to COVID, investments in violence against women and girls in 2018-19 accounted for only 0.8% of Canada's ODA. And with the recent increase in international assistance funding that was so welcomed and announced by Prime Minister Trudeau at UNGA, there's now a significant opportunity to demonstrate Canadian leadership on gender equality by increasing investment in gender-based violence in particular, and particularly given the increased need that Lindsay highlighted in her remarks. This need is also particularly stark in humanitarian contexts. So we know that recent research identified Canada spent only 0.57 million on child protection activities within its humanitarian funding in particular. And there's a real opportunity here to leverage Canada's gender equality and humanitarian action policy by really increasing investments in that specific area so that we can really scale up implementation and focusing on GBV in humanitarian contexts. These investments in GBV must go alongside ongoing commitments and to invest in education. Building on the need for integrated approaches to education and GBV, the funding must go alongside that. So we have seen, and colleagues have presented on the unprecedented disruption to education in the context of COVID-19. So we therefore need an unprecedented response. Canada has recognized leadership on girls' education, and this must be maintained in COVID-19 and beyond. And in this regard, I just wanted to welcome the commitment expressed by Parliamentary Secretary Kamala Khera and last week's girls' education event with UNICEF to really continue to work together with other countries to advance girls' education, including with the government of the UK under its G7 presidency next year. these and other moments provide critical opportunities to mobilize increased commitments for girls' education and protection. And Canada can and must continue to lead by example in this area. So that brings me to my third recommendation. In leading by example, Canada should also call on other countries to ensure education and GBV are critical elements of global COVID response and recovery. Canada has already established a leadership role, as mentioned at the beginning, for example, the Charlevoix Declaration and the unprecedented mobilization of funding for girls' education in conflict and crisis in particular, and now being built further through the development of an international campaign to be led by Canada on quality education for refugee and displaced children, which we look forward to engaging in further. Canada has also established leadership on GBV, as mentioned, through the leadership role of Canada in the call to action on protection from gender-based violence and emergencies, and as a leading donor in interventions, such as the UNFPA UNICEF Global Program to End Child Marriage. So with the unique challenges that we're seeing posed by COVID-19 for education and GBV, Canada has an opportunity to really cement this leadership in the context of the pandemic by spearheading a truly global and coordinated response to the integrated challenges of education and GBV. So for example, this could include convening a high-level, likely virtual event to rally political and financial support from a range of actors to address growing need for GBV and education programming, ensuring that we can protect a generation of girls from the harm caused by COVID-19. And also work with Canadian missions and Canadian partners in country to demonstrate at local and national level Canada's leadership in education and gender-based violence, and to increase national and local awareness of the need for girls' access to education and protection, mobilizing increased support at national and community levels. This could include engagement of the ICPNC and CIPWIG networks teams who respond to these issues on the front line of COVID response. Our members include Canadian aid workers on the ground and Canadian-funded programs from Somalia to the DRC, Colombia to Bangladesh, and many others that Lindsay has highlighted, which already work to create life-changing impact for girls in increasing their access to quality education and protection from GBV. Fourth, Canada can and must focus on inclusion and resilience in seeking to build back better, stronger education and child protection systems to reimagine a world where every child has safe access to quality learning and protection services. Specifically, this could include scaling gender-responsive distance education to reach the most marginalized children, including refugee and displaced children and girls, intensifying community mobilization and support for inclusive education, including for pregnant girls, those at risk of child marriage and other forms of GBV, and refugee and displaced children, many of whom were already out of school before COVID-19. And by building safe and resilient systems, in part by recognizing the importance of teachers within education and protection programming. This should include support for teachers' accelerated accreditation and targeted training in areas including gender equality and inclusive education, social emotional learning, and provision of child-friendly mental health and psychosocial support. This should also include ensuring teachers are trained in basic response to GBV, including child and adolescent-friendly communication techniques and specific issues related to adolescent girls, such as child marriage. And finally, Canada should ensure participation of adolescent girls and refugee and displaced children and youth in decision-making. While we continue to study and monitor the emerging evidence of the disproportionate impacts of COVID-19 on children, particularly girls and refugee and displaced children, we must also recognize their creativity, their innovative solutions, and effective partnerships in shaping response and recovery. Canada should seek to establish mechanisms such as advisory councils to ensure meaningful participation of these different groups and allow for the voices, experiences, and ideas of refugees and of girls to inform and help shape Canada's international systems, including in education and GBV.
Thanks very much, Lindsay. Thanks very much, Annie. Your presentations really highlight the strong linkage between child protection and education, and further really emphasize how GBV is complex, multifaceted, and requires what I think you called a cross-sectoral response, Annie. It also requires all of us to work together, governments, NGOs, other partners. Thank you for your set of recommendations. Your advice on how we can advance this work is really appreciated. We are currently working on one of our minister's commitments about how to move forward on education for refugees and IDPs. And so we'll continue to work with you and others as we develop and launch this campaign. We hope very soon. I'll now turn to our respondents, Girls Not Brides and the Interagency Network on Education Emergencies, who in light of the information presented to us will share some of their insights and perspectives. Rachel Yates is here with us today from Girls Not Brides, a global partnership representing over 1,400 civil society organizations from more than 100 countries around the world, including Canada, that have united to end CEFM. It's a leading NGO on this issue and has been instrumental in building an international movement to end the practice. Throughout the last 7 months, Girls Not Brides has been engaging with grassroots organizations around the world to understand how COVID-19 and the containment measures are affecting civil society and girls themselves. Rachel, can you give us a sense of how the evidence and the insights you've heard today resonate with what you're hearing from your members and your network and the partners you're working with around the world? What's your advice on how we can take action now as we move towards recovery? Over to you, Rachel.
Great, thanks very much. And I very much welcome this opportunity to be on this panel. And it's great to be following the previous speakers, because a lot of what has been said does actually resonate very strongly with what we're hearing from our members globally. I think within the sort of the big numbers, the 13 million girls who may be married as children as a result of COVID, those big numbers disguise the tragedies that are facing girls every day. And I think some of the points that sort of Lindsay made about the need to consider that not all girls are being impacted equally by the present crisis. And already we're seeing that the pandemic and the lockdown measures are widening these inequalities that we're also already aware of. An example of this is that we're hearing from Lebanon and our members working in refugee communities how girls and their families are being affected disproportionately. Often refugee families may have less access to work, their incomes are drying up very quickly, they have less access to services, they're living in overcrowded conditions. So these factors that already put them at a disadvantage is now increasing both their risk of infection as well as their risk of further impoverishment and accessing services. So we're seeing that sort of very clearly. So it's not that these inequalities weren't there to start with, but everything is being sort of heightened by the pandemic. I think the sort of impact of school closures, which has been highlighted by Daniela, is clearly something that's affected a lot of our members. And we have learned from the Ebola crisis of what happens when girls out of school in terms of the risk of early pregnancy. And actually there has been some really sort of positive galvanizing of the movement working on child marriage and on girls' education to look at measures through which girls who drop out can return to schools. So I think it really has provided an impetus to social movements like Girls Not Brides, like the Global Partnership of Education, to work together to really put pressure on governments to ensure that girls can return, whether they're married, whether they've had children. And a lot of really good work is ongoing with the African Union to support progressive measures for girls to get back to school. So I think it is also important to look at some of those sort of responses as well, and also the importance of collective action. We've also been hearing a lot about the importance of data, and I think again that sort of resonates very strongly with us. And we're often asked about, well, you know, have child marriage rates gone up as a result of the COVID crisis? But of course, it's very difficult to show these sort of sudden changes, because the way that child marriage is measured through household surveys, there is a lagging effect. And I think in the same way that you don't wait until people are dying in hospitals to intervene with a COVID pandemic, you don't wait till girls are starting to get married, although we're hearing in increasing numbers that they are, to start intervening. Once you know that girls are falling out of school, and once you hear about the economic distress that households are facing, we know that down the line that is going to be having a massive impact on girls. And that's these two issues, sort of disruption of services and economic impact, is really what's sort of fueling these projections of 13 million additional girls. So the other things that we're hearing a lot about, which I think has been referred to, is the whole sort of the challenge around sort of child protection responses at a time when girls are more at risk of gender-based violence. There is a declining access often to services. In many countries, Kenya, Tanzania, there's been a real struggle to keep child helplines accessible, and often those resources are being used for more public health sort of surveillance systems. So I think some of the measures suggested about ensuring robust child protection systems are particularly important, and to not allow scarce government resources to be diverted completely into public health systems, but really seeing child protection systems as a critical part of the response. And I think one area which I would just like to sort of touch on as well, which wasn't discussed so much now, but as well as sort of looking at the sort of health and education responses, clearly the economic impacts of the pandemic we need to respond to at scale. And obviously, as girls fall deeper into poverty, the risk of them being subjected to transactional sex, the risk of them not returning to school because they can't pay the fees, or being sort of basically married off to as a one less mouth to feed. These are real sort of critical drivers. And I think one of the challenge to this community working on sort of child marriage and gender-based violence is, how do we sort of tackle the economic impacts at scale? And we're hearing from India, from Bangladesh, all across Africa, that the economic impacts are huge on households, and it is a factor that's driving households to marry off daughters. So one of the things that we're starting to look at, and it would be great to join forces with people around this call, is how do we ensure that some of the economic stimulus packages and economic recovery packages are gender sensitive. I was on a call recently where I think there are about 200 new social protection programs being developed globally. But most of these are very gender blind. They're not they're looking at sort of, you know, jobs for men and boys, which, although is important, what does that mean for adolescent girls? And how can we sort of combine some of these social protection cash transfer programs with things like financial literacy for girls, or comprehensive sexuality education, or social norms programming? And there's some interesting work coming out of Ethiopia to suggest that cash transfer programs can help delay child marriage when combined with other interventions, such as positive messaging on girls' opportunities and social norms. So I think one of the recommendations I would like to add, as well as looking at child protection, is how do we link those child protections up to social protection systems as well. I think that, you know, as everybody has been saying, that there isn't a silver bullet in this. And although education has often been seen as the social vaccine, that we need to sort of think about making sure girls go back to school, but also looking at those underlying factors that can keep girls there, whether it's the economic, the child protection systems that can tackle violence and abuse. And this is really going to take sort of multi-sectoral planning and programming. And there are some quite interesting initiatives out there that I think we can learn from other sectors, particularly the HIV sector, who have been looking at what are the big bets that we can make to support adolescent girls. and looking at what is scalable, because a lot of these multi-sectoral programs are very small. They reach less than 5,000 girls. And in the present pandemic, we need to be reaching millions, not thousands. And I think in the HIV world, they've been looking at how you can combine things like cash transfers, safe schools, parenting programs that together can reach millions of girls across Africa, across India, across the worst affected countries. And I think there's a good opportunity for those working on child marriage, gender-based violence, girls' education to come together to really advocate and fund those activities that are going to make the biggest difference at scale. But we're going to continue over the next few months at Girls Not Brides to keep working with our members to identify what's working, to support their advocacy, to get the voices of young people, which we've been doing in India, to advocate for change at a state level and a national level. Because any of these new recovery plans need to really take into account those who are directly affected, and particularly looking at vulnerable adolescent girls and making sure that their voices are heard at a subnational and a national level. But I'll leave it there, and I'm looking forward to the discussion later. Thank you.
Thanks very much, Rachel, for your insights and recommendations. I'll turn now to Dean Brooks, Director of the Interagency Network for Education in Emergencies. INEE is an open global network of UN agencies, NGOs, donors, governments, universities, and affected populations working together to ensure all people have the right to quality education in emergencies and post-crisis recovery. With support from Canada, INEE is leading a stream of work on data and evidence for the Charlevoix Commitment. Dean, you have over 2 decades of international education experience working in complex emergencies, conflict, disaster, and development contexts. What stands out to you from today's presentations? How can this inform the work of INEE and its members? Over to you, Dean.
Thank you so much, Peter. Those 2 decades mean I've gotten pretty old, actually. But yeah, no, this has been such an insightful event, and really thank you to Canada for the leadership they've taken on this topic, and all of the panelists. You know, it really stands out to me. I've made some notes here. Is this connection to child protection. And a couple of years back, INEE partnered with the Alliance for Child Protection, and that partnership continues, and we're continuing to strengthen that. And at our roundtable launch of that partnership in Nairobi a couple of years back, it just really hit me that our child protection colleagues are shining a light on something we don't like to really admit so often in education. We like to think of beautiful schools and chalkboards and everybody sitting in a row and singing a song and learning in a quality environment. But the reality is very far from that. And that's, Daniela talked about that today. All of our panelists have talked about how important it is for child protection and education to come together. And surprisingly, it hasn't been so easy. We all are professionals in our own right. And I remember a conversation with child protection colleagues, and we realized, well, we're not trying to make the teachers the social workers, and we just have to work together is what we're looking for. And that's really what I'm hearing today. You know, GBV is a barrier to education. And what we like to say in our education circles is that education is protective. But we have to work to make that happen. And I think of examples like in West Africa, when you had the crisis back in the early 2000s, and you had cases of, you know, teachers abusing children, and it made it to the media, and it was, you know, the big scandal in Sierra Leone and Guinea and Liberia. And, you know, I was working there at the time, and I remember thinking, how do we protect these young women? And, you know, what we actually implemented at the time was a classroom assistant project, which was very much focused on child protection. And, you know, it rolled out into these classroom assistants becoming teachers at a certain point. But just real lessons learned that we need to go back to. And you know, a number of the articles that I saw are referenced on what works in girls' education. We need to go back to that. We need to scale that up. And then now with COVID and this pandemic and this crisis and these numbers that all of you've shared they're sobering and they're scary, to be honest. And what are we going to do? We have to go back and invest in the women teachers that we need in these schools. And we have to recognize that, and I heard, I think it was Lindsay talked about this real digital divide that exists. I'm here in Honduras actually at the moment, and people don't have access to data plans to do online learning, and schooling is suffering because of this. And so we're going to have to address that. We're going to have to think outside of the box. We're going to have to, as I spoke to the ministry here, this is calling on us to be creative like we never have been before. And there's a lot of work to be done. I think other areas we need to recognize is, the importance of protecting young women and boys as well on all the issues around online learning, cyberbullying. I mean, it's across the spectrum. At INEE, one thing that we're doing, and thanks to the support of Canada, is to really scale up our work on gender and education emergencies. And as you referenced earlier, Kathleen, we have a reference group. Many of you are a part of that. We also have a gender task team that all of you are welcome to visit their web page, but also get involved. And everyone, on this call, it looks like we have over 100 participants. Please visit INEE.org and consider joining if you haven't already. I'm assuming you already are members. INEE is an open network. It's free to join. And we've also been curating resources specific to COVID and specific to gender and education emergencies. And many of you have helped us to curate those resources. So you'll find a specific page dedicated to that. But before I go, just to emphasize, the INEE, that our resources and tools they're global goods. They're resources for all of you, and many of you helped contribute to the creation of them. So we do have the Gender Handbook, which is available in 5 languages. Please, reach out to us if there's any support we can provide. And, this is the beginning of a conversation, and really commend Canada for starting this discussion today. Thank you.
Thank you very much, Dean, and thank you to all of our panelists today for sharing such insightful research and perspectives. We're now at the Q&A portion of our event today. Kathleen, can I turn it over to you to remind participants on how we're going to proceed?
Yeah, thank you, Peter. We're opening now for a question and answer period, and we've been looking at the questions that have been coming up in the Q&A. You'll also take note that a lot of these questions were asking for links to materials that Daniela has mentioned and others have mentioned. So if you look through those questions, you'll see some have been answered with links to some of this evidence-based work. And we'll continue to monitor as new questions come up. Encore une fois, n'hésitez pas à poser vos questions dans la langue officielle de votre choix, en français ou en anglais. And I'm going to start off with a question to Daniela that came up on the chat, but I'm going to build on something as well that Annie said. So some of the people had noticed that the numbers for Honduras were striking and that they were lower, despite the fact that there's a lot of violence in the country. And of course, Annie had also mentioned that, sometimes the school is the most protective environment a child can be in. And I recall that you and I and Howard Taylor, who I've seen from the Global Partnership to End Violence Against Children, when we were working on the Safe to Learn campaign that Canada supports, that's one of the things we talked about, is that in some places, the school may be the safest place that a child goes to in a day. And, how do we build out from that, and at the same time that there's violence that children experience on the way to and from school and in their homes. So just wondering, Daniela, if you have more insights on that data from Honduras and some thoughts on why things are reflected the way they are there.
Yeah, thanks so much, Kathleen. Great question. By the way, I'm sorry, I realized now that I presented my slides and it was hard to see, but hopefully you got what I was trying to say. And I'm actually really glad you brought up Safe to Learn, because I think one of the things that we found over and over again is you need this high level political will to push the agenda forward. And Safe to Learn, brings together the Global Partnership to End Violence Against Children, but also GPE, Education Cannot Wait, and really these platforms for connection between child protection and education that Dean was mentioning before are so important at a high level. And you need that kind of political will. So I encourage you to check that out as well. On Honduras, it just reinforces why we need data. Not every country is the same. And so we need to be able to go in and understand what's happening in the school, what's happening in the community, what's happening in the home. And actually, yeah, we found that levels of violence in school in Honduras are lower than in other countries, but outside, they're much higher. So for example, sexual violence in the home perpetrated by family members is one of the highest in the world for adolescent girls in Honduras. And so school then becomes this protective space where adolescents and kids can go. And that's really important to understand so that you're investing limited resources on the right thing, instead of having this understanding that all violence is equal and happening everywhere. And so I think it just really reinforces that without understanding the problem and having evidence around the problem as well as the solutions, sometimes people spend money on the wrong thing and don't get the impact that they anticipated, and that's why.
Thanks. The next question I want to, I'll kick this off with maybe Lindsay and Annie to respond based on some of what you're seeing from your programs on the ground. And I know, you really have pointed to some of the data, both in terms of the modeling and then what we're seeing now. And we all know that it's absolutely essential to get girls back in school. So Sarah from our Pakistan program here at Global Affairs Canada was wondering if you have any advice on conducting girls' enrollment campaigns in the context of COVID-19. And in particular, in a lot of places, the schools are yet to reopen. We know many are looking to reopen in January, for example. So we need to start working now. Are there any useful virtual tools available for doing that kind of outreach and making sure that these girls come back?
I'm happy to try to answer first, and Annie, if you want to jump in as well, feel free. I'm sure you have some examples as well. I mean, I think I think in the same way that we all have learned to adapt to virtual tools, certainly our programs around the world have done so as well. And so, WhatsApp as a platform is something that increasingly we are using in our programming in ways that we never did before. And so that does mean, teachers having one-on-one conversations with parents and community members to talk about, how their children are doing, providing actual school lessons, and that's, using something as simple as a WhatsApp platform. There are lots of other places where, we are using radio programs. I know in the DRC, we have, mobile vehicles that drive around communities with bullhorns, very simpler kinds of things that we, maybe have taken for granted in the past, but certainly are ways to safely reach out to communities in the context of COVID-19 that we're facing now. I think the other really important point to know is that some of these services, and that was to my last point, really do need to be understood as essential services and can be done safely. So that means ensuring that frontline workers have access to personal protective equipment. We can maintain physical distancing. These are things that we can put into place to mitigate the risk, but still reach communities, still ensure that critical programming continues. And so I'm certainly seeing that. I've been incredibly inspired by the work that teams have been doing around the world and in very difficult contexts to adapt and to be able to continue programming despite the challenges that we're facing now.
I'll just add to that 2 quick points. We've actually found a lot of success working with really at community level and looking particularly with mothers groups in ensuring that there's a real strong value placed on girls' education in the lead up to schools reopening. So that's just one specific example that we've seen particularly from our programming in West Africa. And then the other resource I would point to, just because you mentioned online tools, is a resource called Building Back Equal, Girls Back to School Guide. And that was just released earlier this year by a group of different organizations that really work on girls' education. So I'd recommend taking a look at that, and I'll post a link in the chat box to that as well.
Thanks, Annie. I'm going to turn over to Rachel for a moment. Someone from the End FGM Network of Canada has flagged, how important it is that we're also talking about FGM in these recovery period, and that, we didn't speak as much about this data, but, there is an extra 2 million girls that are expected to be cut as a result over the next decade related to COVID-19. And so maybe some thoughts from you working on a bit of a sister field, and one where we actually do work closely with the FGM community to comment on that particular issue, and what we can do to make sure that this is also included in our response.
Absolutely, and there's obviously a number of countries where there's quite a lot of overlap between high rates of child marriage and FGM. And one of the challenges often in development is that sometimes these programs are working in silos and splendid isolation, which is often, not very efficient, and it means that there's a lot of overlap and duplication. So we've been doing some work with our coalition in Kenya and a number of organisations working on child marriage and on FGM to look at where are there opportunities to actually do better joint programming together. And I think this is where a child protection systems response is really important, because if you're developing a case management system, you don't just want to be looking at girls at risk of child marriage, you want to be looking at those at risk of FGM and other forms of violence and abuse. And similarly, helplines and other support systems are critical for both. So we've been working this year to actually document some case studies of programs that are looking at both, to try to draw out areas of common best practice, including work around social norms, working with religious and traditional leaders, and looking at how movements working on child marriage and FGM can better come together to advocate at a national level. So we're keen to join up with others who are interested in looking at these joint programmatic responses, so that investments can actually tackle too harmful practices or more harmful practices, and provide better value for money as well.
Thanks for that. I'm going to go to a question that's come up, and I think, Dean, you even spoke to this a little bit in your remarks. And that is that one of the main challenges that people find working on violence against women and girls with the education sector is actually getting that foothold with the Ministry of Education at a high level to change their policies, to implement the actions at the national level or the state level. So maybe you could kick off with sharing some strategies or mechanisms that you've looked at. And maybe then, Daniela, you might want to pick up from there in terms of reflecting on the work that you're going to be doing in Cote d'Ivoire and in Honduras around the national action plans, and how we can get more engagement with ministries of education on these.
Yeah, definitely. And Daniela, I think you raised a really good point, that political will piece is so important. I traveled with ECW, for example, to Colombia last year, and was amazed. Somebody who's been doing education for years, and most of the time you can't get an audience, but then when you have that high level coming into a country, all of a sudden everybody opens their doors. And the same thing happened. I went with them to Uganda as well, and the same thing, where organizations that typically wouldn't look at as education as humanitarian response were all of a sudden sitting at the table talking about education for hours. And I think that's a key piece to that recognition, is that political will. So these global platforms that have opened those doors, I mean, that's critical, definitely. But then also, I think, something that can be really helpful, and I've seen that here in Honduras, I've seen it in other contexts, when you look at these global resources and tools that have been created, and then when they can become owned by a country. So for example, INE has the minimum standards for education. The Child Protection Alliance has the child protection minimum standards that are global resources. And those have been adopted by all of our agencies and donors and so forth. But then they can be contextualized to a country. And that's what we've seen in a number of contexts. And it's been very grassroots, where partners have taken the minimum standards and said, okay, we're going to make these the Afghanistan standards. And what do they mean in our context? And there's a process to that. But it's very important to that ownership taking place, and something that we are continuing to encourage. And these standards can inform the national strategies, for example. And I really, often when I talk with governments, I talk about how these standards are really principles to how we implement our work. And that can be a critical, door opening into these contexts. But I'll hand over to Daniela to finish the answering the question.
Thanks so much, Dean. No, that's absolutely true. And I agree with everything you've said. I think that ownership is so important, that leadership. I think you need to elevate the ambition and the level of political will around these issues. And really part of it is the silos. And so, Kathleen mentioned we are working with many of our partners, both in Cote d'Ivoire and in Honduras, to really help support a national response to the recent data. So Cote d'Ivoire launched their survey for the first time a few months ago. It's the first Francophone country that's done the survey. And then Honduras launched last year, and it's the first country in Central America where we also have a lot of data on migration. But really, how do you get multiple ministers to work together to understand that, preventing violence against children and adolescents needs to go hand in hand with education, with health, what we were just describing. And I think it's about political will. It's about facilitating communication and platforms for that coordination. And I think, Rachel, what you said is so right on. This has always been the case, but really thinking about interventions that are multipliers. There are interventions that we know can have multiple kinds of impacts on various outcomes. And these accelerators, some of us that work on Inspire call them accelerators. We really haven't done enough to think about these and invest in them together. Cash transfers is one. There's so many things that come when you support adolescent girls and their families economically, but tweaks to it can have different impacts on unintended pregnancy, child marriage, education, violence. How do we think together about that? Similarly, this idea of how do you create a safe learning environment? It can't just be about, enrollment, attendance, completion, learning. And if you're not thinking about safety as part of that, you've missed the boat. And so this is an easy place for us to connect. So I think the more we can work as a community to identify those accelerators, especially now when we're so strapped for resources, given this crisis we're in, it becomes more important than ever. And that has to be at the country level. It has to be working with civil society and leadership at country level to make those connections. It can't be up here. And so we're really excited about doing that in a handful of countries and really supporting the leaders there to make those connections.
It's wonderful. I have time for one more question. I'm going to put it out there, and I think Rachel is going to kick off a response, and then others can come in if they'd like. But it's a really important question, I think, to think about as we close off our discussion, and that is sort of what are the opportunities and challenges around ensuring that our programming or our policies are applying an intersectional lens. So one that acknowledges that children and girls are not monolithic groups, that there are particular challenges and experiences from their different and intersecting identity factors, so ethnicity and ability, socioeconomic status, and I'm sure Annie or Lindsay would be able to comment too on that status, as a refugee or a forcibly displaced person. But what are some of your thoughts there in terms of your experiences at doing this in a way that takes that intersectional lens? Over to you, Rachel.
Well, I mean, I would say this coming from Girls Not Brides, but I think one of the key things we have to think about in taking an intersectional approach is really the issue around localization. And it has become a bit of a buzzword in humanitarian. But if we do want sort of bespoke, targeted interventions for girls with disabilities, marginalized girls, whilst we do need to go to scale through sort of sector-wide interventions, we also need to have community level actors who are able to identify those girls greatest at risk. And also with the lockdown and the inability of people to fly in and fly out to environments, it is going to be sort of local actors, community-based organisations on the ground. But at the same time, they also need the tools to identify those girls. And I think, you know, Pop Council, for example, have done great work around girl rosters, identifying those who are most vulnerable. And again, it comes back to data, but very local, granular data. And then finally, I'd say it's about giving those girls a voice and making sure that mainstreamed interventions, that the interventions are really addressing their needs, whether it's about education, overcoming the digital divide, and ensuring that curricula is relevant for their needs.
Last word, Annie or Lindsay, on this?
I'll maybe just give a quick example of a challenge that we came across with our education programming for adolescent girls in Somalia, funded by Global Affairs Canada. And this is specifically looking at programming for girls with disabilities. So we know that with the move to a largely kind of online learning system, there have been significant ramifications for girls with disabilities who are at particular risk of being left behind. Because of the lack of accessible quality learning digital content for girls with disabilities. And so we were really worried that this could hinder their access to quality education and also retention. And so the opportunity that we've tried to see there is looking at how we could develop and pilot accessible digital content. So some of the areas that we're looking at, for example, are providing audio options for girls with visual impairment, or recognized sign language video inserts for girls with hearing impairments. And then also working with the Ministries of Education to add captioning and sign language options to radio and TV broadcasts to ensure that we're really increasing access to education for all children, but particularly ensuring that we're not leaving girls with disabilities behind.
Thank you so much. So we're coming to the end of our 1.5 hours, and I'm going to hand the floor back over to Peter for our closing.
Okay, thanks, Kathleen. Thanks very much, everyone, for all of your questions, and to our panelists for your very thoughtful responses. We're really grateful for the many strong grassroots organizations, survivors, allies, like our partners here today, that are contributing towards addressing these challenges, finding solutions, and building the evidence base to move us forward towards attaining the SDGs in this area. Investing in girls, particularly for the poorest and most vulnerable, has transformative impacts on health, education, and economic outcomes for themselves, their families, their communities, and their countries. I can't overestimate the importance of data for donors. We talked a little bit about this today. Resources were scarce before COVID. They're even more scarce now. And donors want to put our investments in the right place. Good data really helps us to do that. International Day of the Girl gives us an opportunity to reflect. I don't have to tell you that it's not just for one day, it's for every day. And so I just want to close by thanking all of you and your organizations for your leadership. I heard so many amazing insights and best practices today. I'm going to certainly walk away with terms like multipliers and accelerators, and the example of cash transfers was really, I didn't quite think of it in this context because I was thinking of it more from a humanitarian perspective, but it's really quite striking. And your commitment and the hard and vital work that you all do every day to make the everyday lives and the futures of girls better is truly remarkable. So once again, on behalf of the Government of Canada, I thank you so much for your time today, for your commitment, and for sharing your insights and ideas with us. Un grand merci à tout le monde. Have a great afternoon, everyone.